Thank you.
Thank you, Professor. Thank you, Professor Chattoraj, and thank you, Swathur. It's always a pleasure. So, as you said, there are each country has had a different experience, and it's a combination. The insurance experience has a combination of both the healthcare as well as which is closer to the way insurance is managed. So that's the way it is. You can see the final impact. So, for example, and I can tell you that UK has had also was very badly hit with COVID in the first and second round. But in UK, the entire treatment of COVID has been taken care of by the government hospitals. So the private insurers, they haven't had a hit. In fact, they had a kind of a bumper year where their losses did not rack up, not only due to COVID, but also postponement of many other elective surgeries, people not going to go out to treat. So many insurers in UK are actually now returning premium back to the consumers. Of course, it's a very complex actual exercise because some of those will come back in later years and come back worse. For example, a postponed knee surgery, how does it really come back next year? All those are being done. And whereas some countries, if you look at, in India, or if you look at in the US, like it's a private insurance or the insurance companies who've taken the brunt. Now, well, this is an event. This is like a massive global event, unforeseen, actually not provisioned for. So the health never looked like in 2020 or 2019. It looked like globally we have come and gone around the corner of having a pandemic like what SARS was promising to be. And SARS in 2003 had a similar scare. But there are many things which have changed. And see, none of these changes have happened because of COVID, but the acceleration of the change is happening because of COVID. And there are many trends that we see. So if I can just share my screen and show a few things, I hope the network will allow me to do so. Is my screen visible?
Yes.
So I will just present maybe a few slides from here. It's the whole future of health insurance we're looking at this point of time. So if you look at the forces which are hitting health insurance, now this has nothing to do with COVID. As I said, COVID has opened up, opened up the skeptics, and secondly, the pace of acceleration is moving. So simplicity is something that people are looking for. People are any complexity in health insurance, and I think consumers will move away. So that's very clear. That's a clear trend. The second trend is the consumers themselves are changing, and their experience that they're expecting from a whole healthcare point of view, they're expecting it to dovetail with the insurance. And herein lies the big issue, because except for 2-3 countries in the world, healthcare and health insurance really do not work very closely together. Natural reason, the expenditure of an insurance company is the income of the hospital system, and therefore there is a natural barrier. However, it is becoming increasingly clear that unless they come together and they work together to give a far better, simple, easy, and easy to understand, easy to experience for the client, the customer, health insurance itself will not go beyond the trust deficit that it suffers from today. Business model transformation is something we're seeing everywhere, and this is not just going and creating efficiency. By transformation, I'm talking about how people work with the ecosystem, how much they can do themselves. Many insurance companies are almost becoming technology companies themselves, the way they are moving. If you look at companies in China, companies in a couple of companies in Latin America, they are actually transforming into almost becoming a technology company, which is offering insurance as something on a platform. So the whole model transformation, working much more with providers, working much more with service deliverers across the ecosystem, is becoming the norm, and that will sort of define the next decade. The fourth thing is trust. Now, trust is actually destroyed by many things. It gets destroyed by complexities, also gets destroyed by poor handling of data. It gets destroyed by non-fulfillment of promise. as understood by client, it also gets destroyed by remaining or saying I am only insurance and I only know how to pay for the claim. So for people to adopt much more, insurance in a far bigger way in countries where there is a penetration, India being one of them, the trust element has to be seen, and trust is normally increased by doing two things, by making things predictable and by making things simple. So simplicity and predictability. Today, when you give a check, you deposit a check in a bank, irrespective of the bank, whether the bank is big or small, or whether it is a private sector, public sector, you know that at 3 o'clock, the clearing will happen, or at high value happen, or any RTGS transaction, it will happen. There's no mystery in it. There's no chance of it not happening. So I think that kind of certainty has to come in. While companies can differentiate on the quality of service, on the speed and the kind of product features that they can do, ultimately certain things like filing of a claim and realizing a claim, which typically goes to the provider, these things have to be made transparent and uniform. The other big thing is large parts of the world, OPD is not covered. This comes out of various different issues. The pharma business has to come and also cooperate with generics. Then the actuaries will be able to really understand the OPD market better. The kind of leakages that can happen, because without it, 70% of the entire healthcare is missing. And if you look at comprehensive cover countries like US or UK to a 75% degree, even Malaysia, there the major part of thinking from the regulator's point of view, from the industry point of view, is how to get more and more covers and not just keep selling the same thing. So I think that's another big trend. The big shifts which we're seeing across the world, and they can be seen from the Nordics to Mediterranean to whole of Europe, places like Germany, North Africa, South Africa, Middle East, Australia, South Korea. If you just put all of them together, some companies that are taking one of these and moving ahead. But these are the 5 big trends. Claim intimation to a claim anticipation. So a lot of analytics, a lot of AI, understanding how people's health or the habits are going to result in claims. I think that's very important. From mere treatment to prevention. From health insurance or insurance as subject being taboo and not being discussed to highly engaging conversations. Now, this you can find if you look at countries like Ireland, Germany. Today, this becomes it's not a taboo subject anymore. And from generic just groups or big professions or demographic big sweeps of demographics to hyper personalized down to the genetic makeup, pharmacogenetics is something which is going to go very heavily right into the heart of health insurance, because technically things like precision medicine, they're going to change the way the treatment is going to be done. So 15-day hospital stay can become 5, in which case, look, can you imagine the impact on the health insurance globally? And from Insula, that is, insurance companies do what they want to inclusive. Now, by this inclusive thing, I mean customer segments, including microinsurance, as well as ecosystem partners and sharing things with them. Well, I'll just move through some of these. Well, COVID-19, yes, one thing COVID-19 has really given a boost to is mental health. Now, every jurisdiction I see discussions on mental health, inclusion of mental health as part of physical health in policies, massive focus on trying to understand the whole concept of mental health from early detection to treatment to maintenance, as much as people have been earlier investing in diabetes and kidney disease and cardiovascular, respiratory, etc. So therefore, and wherever things get invested in, time invested in, money invested, things normally emerge. So what we are seeing is that there's going to be much more emphasis on inclusion and management of mental health in insurance. The other things which are happening is that there's too much cost happening in COVID tests. Now, it is always debatable whether these are to be covered in insurance or not. Again, jurisdiction to jurisdiction, it differs. But if you see COVID-19 testing, vaccination, these are pretty universal in the sense that everybody is doing it. Everyone does something, anything at all, insurance companies suffer. The whole concept of insurance is a certain percentage of people will incur expenses, and not everybody. So however small the expenditure, as everyone starts doing it and multiple times, now this is a subject of big debate in many jurisdictions now. Health tech. Now, where is health tech really moving up? If you look at what are getting funded, and if you look at down below to the different things on the left-hand side, electronic health records, definitely. We were hearing in the earlier session also. Telehealth is getting wings, absolutely. Telehealth with devices at the front, that is taking on real wings in most populous countries, including India. There are insurance products with telehealth now. Mobile health, which is a whole lot of trying to understand health through the mobile device. Wireless health. Now, this is about communities and tracking and the whole thing about smart cities and how do you really manage community health. And finally, how do you manage the medical records, not just health records? And there's a distinction. I must bring the distinction on the table. Keeping health records is static data. It's to be utilized for analytics, but medical records are something which are much more sensitive, much more, you can say, one of those personalized sets of data where all the privacy will come in. It much more, and that's something which, on the flip side is going, or the good side is going to come back in and help insurance companies read better. Now with the National Digital Health Mission in India, something akin to the entire health records in the whole management of health and medical records that you see is in other countries. That's going to be important. So I think okay. Then the other couple of points I want to make here is, well, people are all across all over the world. This is what I want to just say as an aggregate. Insurance companies are trying to focus on new users, more of youth, because youth typically is underinsured and do not want to, or create new markets like microinsurance. Change the whole competition framework from things like what people are fighting for to go and offer additional services. So through these, expand the whole value chain. And after a long time, I see massive supply chain discussions coming in. Companies have to also retain customers, so the whole overall service levels are increasing. An example of, let's say, US, if you look at the Kaiser Permanente example, the Kaiser Foundation hospitals and the Permanente Medical Group and the health, they all work together. They all don't work together all the time, every day in every part. But they have identified where all they need to work together, where they offer medical records, prescription appointments, tests, insurance cover with access. So the point is, it's important to understand that when we say the providers and the payers have to work together, we're not asking them to form joint ventures all the time. We're not asking them to work all the time exclusively on each other's business and then stepping on each other's feet, but to find the right mean. Attention to the customer now. We are all the time on WhatsApp now. The question is, how WeChat is being used if you look at China, and how WeSure as a platform on that works. This is an example of how this can we can probably embark on something in India, for example, on WhatsApp, where the entire intimation process, the application process, the taking care, constant engagement, constant, the care element, as opposed to just the cure element, they can be managed. Because it is impossible for people to change their lifestyle for insurance, because insurance is not a big part of anybody's life. However, insurance is to come in as embedded insurance through things we do. And that is another huge trend. Well, the many case studies, Ping and I spoke of, Ping is also somebody who has gone into the Good Doctor platform where they're offering 24/7 advice and so on and so forth. Vitality, all of you know about, which has made a whole business globally. And they're now present almost all over the world on the concept of health age, which is what is your actual body age. It's not the chronological age all the time. And so many other services have come. This is an interesting example because this company is specializing on high net worth and elderly. Now, normally, these we do not associate with insurance, and people fear to tread in these. The elderly, how do we take care of them? And the high net worth, who really don't think they need insurance. So this is an amazing trend where people are now moving in search of new businesses, not just for young, healthy individuals, but impaired health, elderly, as well as trying to find their,
Mr. Roy, if you could, we do the paucity of blood, you have to.
Yeah, it's just 2 slides. I'll just finish it off saying if you translate it back to India, India is a massive opportunity. Only 5% of the healthcare market is covered by insurance. And the secret probably lies in OPD. If I look at the trends globally where markets are covered fully or people are covered comprehensive, I think outpatient has to be very, very important for India. We all have all these platforms. No other country has a wealth of all these platforms that we have, coupled with people all the time on the phone. And I think the future is only bright, but we have to find the right pressure points. Thank you.
Thank you so much.